Hey guys, I found an article that compares neck pain and neck range of motion between two randomly split groups, one receiving self joint mobs and the other self stretching. Both groups had pain relief and improved range of motion, but self joint mob group had a significant increase in neck extension range of motion. Sounds great, right? Wrong. It's got lots of flaws. Let's talk about it.
So, one of the first flaws, and surely not the last, the eligibility criteria was not specified. The most we get is patients with cervical dysfunction and pain. So, to improve this, we need to specify the external validity of the, such as what type of cervical spine dysfunction. Are we talking about acute or chronic pain? Did patients receive prior treatment or any prior surgeries? And then another flaw in this study was it was not specified if it was a concealed allocation. So to fix the potential bias, the assessor should have had a randomized way of separating the groups via a closed envelope randomly chosen, which would have helped improve the internal validity.
On top of that, the patients were aware of what group they were in, and the therapists were aware of what treatment the patient was receiving. So, to make this better, we would make this study a double-blind study, meaning the patient would not know what group they're placed in, and neither would the therapist know what treatment the patient is receiving. And this would make the study more reliable and help improve the study's internal validity.
On top of that, they had the pain scale that they all used. And the assessor wasn't aware of which group this person was in before viewing the pain scale. So they should have been aware of that. And they weren't aware of how many people even filled out the pain scale. So, and for all of that, they should have known who filled it out, what group they were in, how many filled it out, and it just would have been more effective.
Finally, the study's objective was to investigate the effects of short-term joint mobilization of the upper spine using a wedge on the pain and the cervical dysfunction of the patients with neck pain, but it didn't specify an intention to treat. So the patients really didn't know if this was supposed to help them or it was just to test different methods on them. And then overall, the proposed methodology that we've implemented for this study could definitely show improvement and it's feasible and reliable.